Welcome, everybody, and thank you so much for being a part of this show. Early on a Sunday morning, it is Spotlight on the Community, and I am your hostess, Denise Westwood. I've got 4 people, possibly 5 if you count their photographer. That's unusual. People don't usually come with their own photographer, but that's very cool, and I know why he's here. So thank you very much for being here as well. And we've got the head gal, and that is because she is the breast and thyroid surgical oncologist, the medical director of clinical outcomes. We're talking about Nimmi Kapoor, right?
That's right. Thank you.
And you're with Breastlink. That's what it says here anyway on your business card, and we're going to talk to everybody in the room. And the thing that I need to point out to folks is this show, we're still in October. This is the last weekend of October for 2015, and every year I do this show. In October sometime, I want to get this show on the air because it's important, and it's about breast cancer because October is Breast Cancer Awareness Month. So that's really why you folks are here, and I want to say thank you again. And for you, Dr. Kapoor, I know your time is super valuable, and I appreciate that you would take the time to come here and talk with us.
Thank you for having us.
You're so welcome. And to point out the other folks, we actually have one of your patients who is a cancer survivor, a breast cancer survivor, Mila Ivanovich. Good morning.
Good morning.
How are you doing?
I'm very well, thank you.
Okay, great. We got that. And we also have Monique Jenkins, the marketing director for what is known as Integrated Cancer Institute, which includes Breastlink. And I know that Breastlink is on these business cards that I got from both Paul, who we've yet to introduce, and Dr. Kapoor. Good morning.
Good morning. Thank you for having us.
And then back there in the corner, we have Paul Calacchio, who's also with, Breastlink, right?
Yes.
Yeah, and you were kind enough to bring all these folks in today, too. So, Dr. Kapoor, I always find it interesting, and we can start here because we do have time. I always find it interesting, how do people arrive where they are? So, how did you decide, or was there a pivotal moment in your life where you thought, this is the kind of, I want to be a doctor. That probably was apparent, right? But what kind of a doctor, and how did you arrive at the decision to do this kind of work?
I think we all have our own circuitous paths in some fashion. My parents are both doctors. So I had the doctor gene in me somehow or other before I knew it. And I'm the oldest. So having
no pressure.
Yeah, no pressure, nothing. I had two parents who were great role models and doctors, and they helped me towards my path of wanting to pursue a medical career. I thought either teaching or medicine would be the right thing for me. And as I learned more about it, you actually teach in medicine. You teach your patients every day.
You should be, is what you're saying. You should be. If you're a good doctor, I think you are.
Yeah.
And you are.
I hope so. I hope so. I think especially with cancer treatment, you really have to educate not just the patient, but the patient's family members, the community also. So we take a lot of pride at Breastlink in educating. And so in a sense, I got to be both in choosing medicine as a career. Surgery was not something I expected at all. I have a mother who was in family practice. My dad is a cardiologist. So surgery was probably the lowest on the totem pole as far as things I'd be interested in doing. When it came down to it, I realized I loved actually completing a task with my hands, and that was really fun. To be able to say, I'm not just going to prescribe you a medication and wait, but I'm going to do something to you and it will be done, was really satisfying. And then cancer is one disease that we are still trying to learn more about. And so breast cancer especially is a rapidly evolving field. There's a lot of research involved in it. So it became, there was a movie once and in it, the movie, I can't remember the name of the movie. It was a great movie.
Somebody else might remember.
I
Just
know.
tell us a little bit about it.
So it was somebody coming back from history into the newer age, and he said, "Oh, you're to this woman, the actress. Oh, you're a researcher. That's perfect. Women should make excellent researchers." And I took that to heart because really at the time I was so intrigued by research and cancer research. So I've melded all of the things together, teaching medicine and research into my career. And as a breast cancer surgeon, I get to do all of it. I also have a passion about thyroid cancer because it turns out that the research is all very similar. There's all looking at genetics of cancer and development of cancer and then treatment of cancer all becomes one ultimately. So surgery and cancer care and research all all came together, and this is what I found.
And how long have you been doing it? The breast cancer?
Well, I knew breast cancer was going to be my path about 8 years ago, and so I did focus my training into that. I did a few extra focused rotations at Sloan Kettering in New York, and then I spent a year fellowship with the St. John's with Dr. Armando Giuliano, who's a local surgeon here too, and trained with him in both breast and thyroid. So I've been doing that now with Breastlink for the past 3.5 years.
And maybe this is a good opportunity for us just to take a break. What is Breastlink? Who wants to take the helm on that?
I'll start.
Okay.
I'll start. Breastlink is an amazing, comprehensive network of breast health centers. So we have our huge imaging department, which is focused women's imaging.
Where's this?
Well, we have several locations.
Okay.
That's a good question. Primarily, we started in Orange County. So our hub, our home is in the city of Orange, in Orange County. We also have centers in Laguna Hills. We have a center in Temecula Valley. We'll be opening up in Newport. And our most exciting new development will be in Tarzana. At the Integrated Cancer Institute, we will have a Breastlink location as well. So Breastlink is not just imaging, though, because I work for Breastlink and I'm a surgeon. So we have breast surgical oncologists, so people who actually are trained to treat breast cancer surgically. We have medical oncologists because it requires sometimes chemotherapy and other systemic therapy like tamoxifen. And we work all together in one roof. And the really nice thing for patients is that we also have our plastic surgeons under the same roof. So when you come to Breastlink and you have a problem with your breast, whether it's cancer or not, you have a whole team approach with the radiologists, the surgeons, the medical oncologists, a plastic surgeon as well, coming together to help you get through that process. And then after, or even sometimes while you're in that process, we have other support available. So we have a nutritionist, a health and wellness specialist, someone who is there for psychosocial help and education. Some people can't either afford their treatment, or they're dealing with a lot of social turmoil. When you get a breast cancer diagnosis, sometimes you're worried about your job, you're worried about paying for care, you're worried about taking time off. So we have all of that together, which is, I think, a really nice model for
the patient.
patients.
It's ideal. I mean, to one-stop shopping, so to speak.
Yeah, we hear that term. I don't like that term. I think it's
sorry.
No, it's fine. It's true. It sounds cheap, and I think we're kind of like more of the Nordstrom or Bloomingdale's. I think we give good quality care.
Well, I didn't say what kind of shopping. I just used the word shopping. It could easily be those upper class stores.
True.
It
That's
could be
true.
Bloomingdale's.
There you go. That sounds better to me.
What a great description and what a great operation, because now what we're going to do, this is one of your patients.
Yes.
And we're talking about Mila Ivanovich. Good morning.
Good morning.
Thank you for coming here.
You're welcome.
You know, when it comes to people's health, not everybody is comfortable talking about it because it's so personal and or painful or, emotional. I mean, the whole thing, right?
It can be with some people, yes.
Do you want to tell your story?
Sure. I was diagnosed February of 2014 with invasive ductal carcinoma.
And this was your doctor, Dr. Kapoor?
Yes.
And
I had two, she was I went and had 3 opinions.
Good for you.
And I did a tremendous amount of research.
Oh, awesome.
And my third was with Dr. Kapoor, and I stopped there and was just thrilled to be with her. I think our first session was maybe 2.5 hours together, and she was my person.
Who does that? I mean,
exactly.
When you get that kind of attention and caring, who does that?
Yes.
We salute
exactly.
you.
Oh, patients need that time.
Yes.
I think it wasn't just me, though. We had you meet a few others within the group, which helped.
But you were my person.
And you knew right away.
I knew we connected. And I'm happy that I had to take the route to get to her, and because I learned a lot, and I learned what I didn't want to do for my particular type of cancer. So when I found Dr. Kapoor, then I was in with the Breastlink group, and my surgical or plastic surgical oncologist, Dr. Gown, was in the same group. So I feel that I'm fortunate, the team that is assembled at Breastlink. They're just extraordinarily gifted.
And what was your stage?
I was stage 1.
Yeah, because that's when it comes to
Yes.
cancers, I think we all know this, just even the general public, it's always staged. 1 being the least, 4th being the most, right?
It's a great question. Actually, Mila was just asking me earlier if we're going to get rid of stage, because stage is important on a population sense and how we can look at all comers and give you an estimate of your life expectancy. But really, truly, breast cancer and actually all cancers come down to more than just stage. It's more about the biology. So sometimes stage 1 breast cancer needs everything: chemotherapy, surgery, radiation, and hormone therapy. Sometimes stage 1 only needs a little bit of something.
And initially, my first diagnosis was not a stage 1. They do the number scale from 0 to 9, and my initial diagnosis was between a 6 to a 7. After my surgery, and I had a Mammogram, which is a newer test, and that revealed that I really wasn't a 6 to a 7. I was more, they bring it down to staging, and I was I was a stage 1.
Yeah, so Mila's referring to her grade, her cancer grade, right?
Mm-hmm. Nice. So we're going to take a little break, and I know there's tons more to talk about. And I think that we haven't really heard from you, Monique, yet, have we? No.
Not yet.
And Paul, who's over there in the corner, we haven't heard from you yet either.
No, not yet.
And when it is time, if you wanted to say something, you'll have to run up maybe and share Monique's microphone. Just kind of lean into her, because you guys work together anyway. You know one another. We are talking with Dr. Kapoor, and thank you again for being here. And also patient survivor Mila Ivanovich. We're going to get more of your story, if you're okay with that.
Yes, absolutely.
Awesome. I'm Denise Westwood. This show is Spotlight on the Community. We are 95.5 KLOS, and we are coming right back. Welcome back, everybody. Thank you for being here. And I wanted to say, because I never always say, sometimes I forget to say thank you to my engineer, Franz, who's really good at what he does. So Mila Ivanovich, who is the patient survivor, cancer survivor, breast cancer survivor, let's get specific here, with Dr. Kapoor, who's still in the studio also. We've got Monique and we've got Paul. He said he doesn't need to talk, so we thought, okay, we'll let him go on that. Mila, back to you. Yes. And I'm not sure that we fully understood. So you know what happened, your diagnosis. You found Dr. Kapoor.
Correct.
You loved her, and I see why. And you knew you could get all this other help from the same location, basically.
Exactly.
And what did you end up happening? Did you have the lumpectomy?
I did. I
Okay.
had a lumpectomy and a little more. And I had that surgery with the plastic surgeon and Dr. Kapoor. It was about a 5-hour surgery. And then I had the Mammogram test, which revealed that I did not need, my specific type of cancer would not benefit from chemotherapy. So I was able to dodge that bullet, and I went right into radiation.
7 weeks?
Yeah, yes.
So it's like 5 days a week, 7
Yes,
weeks?
yes.
So let's go back to this mammoprint that I keep hearing about. How new is that?
Mammogram is a genomic test. So it takes the tumor and it looks at the genes that are expressed in that particular patient's tumor. And then it categorizes it from a low risk of coming back or a high risk of coming back. And Mila's, fortunately, was low risk. And so we know, even though her tumor was over 1 centimeter in size, it qualified for chemotherapy treatment. We know because of the biology that we learned from the mammogram that she actually doesn't need chemotherapy, because this is not an aggressive tumor in particular. The other thing that Mila mentioned that she kind of didn't go into, because she's shy a little bit, maybe, but she had a very special surgery. She didn't just have a lumpectomy. She actually had what's called the Oncoplastic Procedure. So because we have a plastic surgeon with us, she was allowed to have both her breasts reshaped. So we had the cancer removed on one side. And then on the other side, we were able to make and shape the breast to match. And so she had a really nice operation for her.
That sounds pretty special. So now you have, for lack of a better description, two matching breasts.
Yes, exactly.
Which makes you very happy.
And my husband.
Oh my gosh, you guys. So, but I want to go back and forgive me for honing in on this, and thank you for explaining it. What is the MammoPrint? How long has it been used? Because years ago, you would hear stories of people who had no choice. You've got this, you're going to have that. And now we have access to getting more information, which could limit the treatment and make life a little bit easier on the patient. So how long have you been working with MammoPrint?
Is actually a newer
Yes.
genomic test.
So like 3 years, 5 years?
No, over 5 years.
Okay.
But actually there's a few other tests that are older than that, or a little more well known. The Oncotype Dx is a genomic test that's been used for about a little over 10 years at least. And we have a lot more data on that test. There's a lot of new genetic tests coming out
Which is awesome. Because when we think about the old days, and that's silly, the Brachot Test, and everybody kind of heard about that, and it's been made more popular in recent times because Angelina Jolie and her story, and she tested positive, and she decided to have both breasts removed, right? Mm-hmm. So all these new tests, though, my goodness, that's awesome.
Yeah, that gets confusing, though, for patients and listeners also, because we're talking about two different types of genetic tests. The test that Mila had that we're talking about, it's actually looking at the genes of that cancer. The test that Angelina had is something we are actually very passionate about. I actually have spoken nationally about it, presented research on it, is a genetic test looking at what your parents gave to you. So looking at hereditary cancer, what your mom and dad have graciously passed on, whether you want it or not.
Which you can actually see in the test.
Mm-hmm. Yeah.
Not where you'd go to a physician and they'd say, okay, tell me about your family tree. Who had cancer in your family? And if you think you're in jeopardy or you might have breast cancer, how about your aunts, And now they can really hone it down to science is what you're saying.
Mm-hmm. That's right. It's a really fascinating, exploding field of personalized medicine, not just looking at the tumor, but also looking at the patient's genes that they've inherited.
Oh, I just think that's wonderful.
And interestingly enough, I had the genetics test first after I had my diagnosis because my mother had breast and ovarian, and my mother's sister had breast cancer. However, I never quite fit the parameters of the genetic testing, and there was a very, very valid reason. It was when they were diagnosed, at what age they were diagnosed. So I had the BRCA 1 and 2 genetic testing done, and mine came back negative.
Awesome. I'm sure you were like going,
well, and it was a huge relief because
Yeah.
I have 2 daughters, so that to me
because if you'd been positive, you might
one
pass
of them. Well, there was a stronger likelihood that one of them would have had it before they were 30.
And how old are your daughters?
My daughters are 23 and next week turning 21.
And I know this sounds corny when people say this, but I will say you don't look old enough to have daughters that old. And I know how old you are too because it came in my literature. But you don't look that old. And we're so glad you're happy. So congratulations
Thank
on
you.
that. But if we go back for just a moment, because really, some women who might be listening at this time to this show have been through this, either personally or with somebody that they know or somebody they love, and you can come from the patient perspective of. It's a notable blow.
It is, but breast cancer today does not have to be a death sentence, and it is very curable. And there is a lot that women today can do to help themselves. And education is key, finding the right team, assembling the right team, exercise, and keep your weight under control. Those are, nutrition is there is so much research today about nutrition and the benefit of exercising during cancer treatment.
And after.
And I exercise through treatment constantly. I was spinning 3 to 4 days a week.
Yeah, it really is.
And it really helped to push me through treatment.
What about stress?
Exercise helps tremendously.
Because stress, one of the things you might hear from somebody who is a cancer survivor like you, and I'll ask you because you're here, if you look back at the time period leading up to your diagnosis, was there anything in particular going on in your life that was extremely stressful that you can pinpoint and go, yeah, we were, moving, or I don't know what it might be, just anything?
Well, I think stress plays a huge part in our daily lives, and of course, once you have a diagnosis of cancer, I I think we all look back and say, how do we think this happened? How do I determine when this happened? Yes, I'm not sure what I can pinpoint. I think just being a parent, and having children,
some people might say, "Oh, this catastrophic event happened," you know. And I've heard that from people who have gone through cancer events. Wow. Well, thank you for sharing all of that. And is there anything you wanted to add in, since you are her physician, Dr. Kapoor?
I mean, Mila is an inspiration. A lot of my patients are inspirations to me, just to see what she's gone through and what she's accomplished. She's quite remarkable with how she's kept so diligent with her exercise routines and her health and her lifestyle. She's really said, all right, I had a chance for cancer to get me, and no way, man, and it's not happening. And she put a stop to it, and she focused on her health and her lifestyle, and I'm very proud of her.
Are we still looking at the statistics that they have used in the past about if you make it to the 5-year mark? Are we still talking in those terms?
For some cancers, yes.
What about her particular scenario?
For Mila's, yes, same thing.
So you've told her at 5 years things then are looking good?
Well, we've actually told her now things are looking good.
Yes.
So she's in a very favorable category for all reasons.
I'm working on getting my BMI even lower. That's what the oncologist, that's what he wants me to do. So he had talked about the benefits of lowering your weight, even, to try to get as lean as you can, get your BMI down. And he said that there is strong data to support this today. So I will continue to do that. And right now I'm essentially eating fruits, vegetables, and a little bit of salmon every day.
and I hate to be rude, because nobody wants to talk about their weight. That sounds awesome, actually. And no, you don't have to give us specifics, but have you dropped a lot of weight?
I did. I lost 25, and he said he would like me to do another 20.
Really?
Yes.
Which will take you back to when you were a teenager.
Thank you. You're very kind, Denise.
So for the listeners, Mila does not look like someone who needs to lose so much weight at all.
At you right now, yeah.
But
not at all.
But he would like me as lean as possible. And there is data to prove that.
Yeah, and not only that. I mean, we know that being overweight increases your risk of developing breast cancer. Being overweight increases your risk of dying from breast cancer. But what's really interesting is that giving a pill, tamoxifen, which Mila was actually on briefly, can help lower the risk of breast cancer. But if you can lower your weight and improve your lifestyle, you don't even need that pill to benefit you as much. Well, so your lifestyle becomes even more important than some of those medications.
Yes.
So that's what we're trying to focus on here.
Well, but you're a very forward-thinking physician, and unfortunately, and I really believe this, not all physicians are made the same, and I think that there's probably still a great portion of your community that is old school that would say, no, you have to just follow this, she has to take tamoxifen for so long, and blah, blah, blah. Am I right?
That's true. There's also newer tests, though. So we actually, no, there are. We can, we know now scientifically there are some tests. One of the newer ones is called the Breast Cancer Index, and it looks at actually the need for using tamoxifen, or the benefit of using tamoxifen for extended lengths of time. So we can actually ask the questions. Mila
and I had
that.
Mm-hmm. Yeah, I had that Breast Cancer Index test, and it came back, and the likelihood of this particular cancer drug helping me from 0 to 5 years and 0 to 10 years, the likelihood was extremely low. Mm-hmm. So
it's true. Not shoe doesn't fit everyone.
It's greater for me to try to keep my weight under control, watch what I eat, continue exercising.
Good for you.
And I'm off cancer medication.
Yay! And cancer free.
Yes.
Yay!
Absolutely.
We're talking with Mila Ivanovich. Thank you again for sharing your story. We're not done with you yet. And also, Dr. Kapoor, thank you again for being here.
My pleasure.
And what else? Monique, well, we may have to come back and just talk to Monique, because she's sitting here so pretty, and we haven't really gone to her yet. And then, of course, we're all going to continue to talk, because we've got so much more to talk about. October, Breast Cancer Awareness Month. I'm Denise Westwood, and I am your hostess. The show is Spotlight on the Community, and we will be back here just in moments. We are back. Thank you so much. Yes, the show is Spotlight on the Community, and thanks again to Well, Dr. Kapoor, and also we have Mila here, who is the patient survivor, and Paul over in the corner. Want to talk with Monique Jenkins, who is the marketing director for what is Integrated Cancer Institute, and that's coming to Tarzana.
It is.
And then it's also going to include what they've already been talking about here this morning, which is Breastlink.
Absolutely. So the Integrated Cancer Institute is opening the end of 2016. Basically, what we will be providing is personalized cancer care, and we will.
Is this for women and men, or just women?
It will be for all patients,
and all
every
types
type of cancer,
Okay.
every type of cancer. The services that we will be providing in the cancer center will be radiology, pathology, radiation oncology, medical oncology, Breastlink, Dr. Kapoor, Finesse plastic surgery, women's imaging, surgery center, health and wellness specialists, psychosocial services. So we're so excited to be able to offer this comprehensive cancer care to our community.
Is this new, or are there a lot, not necessarily your one, but are there others like this that exist, or is this really cutting edge new?
Yes, this is cutting edge because it's going to be a complete comprehensive facility. A patient can walk into this center and see their OBGYN, see their medical oncologist, see their breast surgeon, all basically in one central location.
Mm-hmm.
So there are similar facilities throughout the San Fernando Valley, but nothing like what we're bringing.
And you said that's coming next year in 2016?
Coming at the end of 2016.
Wow, that does sound amazing, because frequently over the years, a time ago, you'd be piecemealing these things. You'd be going here for this and over there for that, and then driving a lot.
Yeah, that was one beautiful model of Breastlink. We talked about it once, the one-stop shop, where you have our radiology, surgery, medical oncology, and plastic surgery in one roof. What the Cancer Center does, what the Integrated Cancer Institute does, is it brings those pieces together for Breastlink, but also we bring radiation oncology on board. We bring primary care and OBGYN services to the table as well. So it's even more comprehensive, if that's possible.
Mm-hmm.
To do this kind of a venture is really it's got a lot of foresight to it.
And I think, what I think is also unique about this is that each patient, like I said, will be getting personalized care. But in addition to that, there will be a team of specialists working together to determine the patient's cancer approach, what the treatment planning would be for each patient. And I think that's pretty amazing. Not just one physician will, determine that patient's care. So I think that
a lot of input to make decisions about each patient, because no two cases are the same, right?
That's right.
They have to be personalized. Wow.
And that's what we will bring.
That's awesome.
It's very exciting. Every time I talk about it,
I can tell.
I smile from ear to ear. It's very exciting. So we do have a website.
Yes, please.
So please visit us at www.ici.care.
Okay, great.
For further information and continuous updates. We update our website on a regular basis.
Thank you. So to go back to Mila.
Yes.
What kind of a name is Mila? I should know this.
Serbian.
Nice, very nice. I know you have told us a great deal about your story, and thank you, your journey. What about supplements? Do they play a role in your well-being?
I feel they do.
Okay.
I also go to an herbalist and an applied kinesiologist.
Is this new? I mean, were you doing
no,
this?
No,
This is since the cancer
yes,
diagnosis.
I've been a vegetarian for 47 years, so I've always been
now, wait a minute
out
here.
of the box.
It wasn't like you were living unhealthy to begin with.
Yes, but it's, you need to clean up. I needed to eat cleaner and greener.
So does this mean no alcohol?
I did a 21-day liver cleanse this summer, and that jump-started me into cleaner eating. And when I reevaluated what I was eating, even though I thought I ate pretty well, I wasn't. So small amounts of alcohol. And I will say that if you can say goodbye to alcohol when you're going through breast cancer treatment, that is only going to help you heal faster. I've seen women get stuck, and, to ease some of the pain, they drink the same or drink a little bit more, and that's not going to help you.
So you had the radiation, but no chemotherapy.
Correct.
Because you were deemed not to need the chemotherapy, which was, like you said, you dodged a bullet. Did the radiation, though, because it is known to make you tired, did it make you tired?
It made me extremely tired. The first 3 weeks I was in great shape, and it knocked me by the fourth week.
Yeah.
Well, I was I went and had treatment, and I scheduled. Lucky me, I scheduled the treatment every day at 11:30 at the hospital, and then I went to go food shopping, and I had my food in my cart, and then I couldn't walk.
Oh, you literally couldn't walk?
I couldn't walk. I was so exhausted, and so you just get these waves of exhaustion, and I made it. Someone helped me. I made it to the car. And then I just had to sleep in the car.
Take a nap before you could drive.
Before I could drive.
Smart.
Yes.
Yeah, because driving is so dangerous.
And people think that radiation is a sneeze, and it's not. I've seen people step away from radiation, get very sick. I've seen some men get very sick from radiation. Or burned. Yes, I had that. I had a lot of that. But I think your mental piece is extraordinarily important going through treatment.
Anything in life, your attitude plays a huge role, and certainly you took an active role in your own health. You were shopping for the right physician and the right treatment, and you were educating yourself. And unfortunately, you had insurance, because this is unfortunately this isn't cheap.
No, it isn't.
And even if you have insurance, you still have all that other stuff you have to pay your portion.
And Denise, even though I have excellent insurance, there's some of the tests
are not covered.
Are new. They're newer, and they are experimental from the insurance standpoint. So there is a great amount of time spent back and forth, with the insurance company and the medical staff at the insurance company who reviews that. So then, someone like me, I need to go back to Dr. Kapoor and her staff, and she has to submit peer reviews and other documentation to substantiate the reasoning to have this particular or any of these particular tests.
Does it work? Do you find, Dr. Kapoor, that works a lot, or they still say, no, we're okay?
Yeah, well it worked. Mila, right? Yes and no.
It worked for one. We're awaiting the second one, because the breast cancer index test, we remain hopeful.
You also hear about these breast buddy programs for people going through what you went through. Did you have something like that?
I didn't, but I counsel women.
Oh, so now you're helping women.
I help a lot of women, yes.
Who are diagnosed and going through their own journey.
Yes, throughout the country. I talk to them on the phone. Some one I visited, and it's ongoing.
So who got you involved with that? Did you, Dr. Kapoor?
No, Mila's on her own on that one. We do have a support group at Breastlink. We do provide a
breast buddy program.
It's a volunteer program. The women who are volunteers at Breastlink have already gone through breast cancer care and treatment, and they've, like Mila, want to step up and now help a newly diagnosed woman and help her get through that and her family. But no, what Mila is talking about, she's done all on her own. She's quite amazing.
And you made her sound like she was so shy. So, Mila, your husband, it's not just, when you get a cancer diagnosis, it's not just you.
That's correct.
It has a huge ripple effect. It affects the family, your husband, your children, your family, your friends.
And I thought about this a lot because of having gone through this with my mom and having two young daughters. And my daughter Caitlin was a senior in college in Chicago when I was diagnosed. And, some people like to use the internet when they're diagnosed, and they want to call a lot of their friends. And I found out very rapidly that telling a lot of people was not good for me initially. Telling a lot of people was slowing me down, and it was a lot of work, because I ended up spending a huge amount of time consoling them with my diagnosis. So
this is backwards.
Yeah, but when I heard my daughter in Chicago, when I heard her reaction, I had to peel her off the ceiling, and she wanted to quit college and come home and take care of me. And I knew that I needed to really step up to the plate and to be a strong role model. So I decided to handle this breast cancer as quietly and as graciously as I could, for my daughter's sake.
Was she able to stay in college?
She did. She graduated. Yay. She graduated on time, yes, and she has a job. So.
She's these are great stories. Your story.
Thank
and
you.
All those
Thank you.
stories and all the help you're giving other people.
Yes. And the other thing, if I may.
Oh yeah, we've got time.
Talking to women that have had breast cancer 10 years ago, or Sally's girlfriend's cousin who had the breast cancer 15 years ago, I would say to women, hesitate before you do that. Talk to your doctors, because how breast cancer was treated 10 or 15 years ago is not how it's being treated today. And there is so much phenomenal testing and phenomenal ways to treat breast cancer today that I think it's really important to be careful who you talk to. And the one question you should ask is, how many years ago did that person have breast cancer, how they were treated? Maybe listen, but I wouldn't take a lot of sage advice from, I would talk to your doctors.
Sure. And things have changed a lot. I mean, in
Huge amount.
Just in this short time you folks have been here this morning, I've learned a lot about how things appear to have progressed and changed. And yay! I mean, and there's a lot on the horizon, I'm guessing, of what could be happening. In fact, we're probably going to take a break here, and we can come back and talk about that and some other things I know that we've not hit on yet this morning in our final segment that's coming up. So thank you again, Mila, and thank you, Dr. Kapoor, and thank you for your input as well, Monique. And there he is, hanging out. Paul. I'm Denise Westwood. This show is Spotlight on the Community, and we're going to take a break. 95.5 KLOS. We're coming right back. Welcome back, everybody. We are into our final segment. I know I've said it before that October is Breast Cancer Awareness Month, and certainly that makes it a note to get this show on the air, on my show, Spotlight on the Community. I'm Denise Westwood, and I have the good fortune of having Dr. Kapoor here, and also her patient who's a survivor, Mila Ivanovich, and Monique, who is with the marketing director position for the Integrated Cancer Institute, which will include Breastlink, which is coming to Tarzana in 2016. And I know you had said that website is ICI.care. Speaking of websites, I'm going to go back to Dr. Kapoor right now and say, please give us the Breastlink website, because I know that some people may want to go there to learn more.
Yep, it's easy. It's breastlink.com.
That's easy. And maybe I thought you had a commentary about your patient.
I was thinking about Mila's comments, and a lot of people think, well, you can be healthy and get breast cancer too, so why bother being healthy? And especially in Mila's case, I think, not do I think, but there's plenty of data showing that women who are obese and get breast cancer have much worse outcomes with their breast cancer. So I think it really did save you, Mila, and you got to take some credit for that, for being healthy and having already a healthy lifestyle ahead of time, that your cancer was easier for you, and your treatment was easier, and your outcome and your outlook is going to be much more favorable than had you not taken the time to be healthy. So it's a really big, important issue that we all be healthy before cancer as well as after.
Correct.
Okay.
Thank
so
you.
Yes, and congratulations to
Thank
you.
you.
I don't want to downplay how wonderful you are.
Thank you.
Because I think what we were talking about during the commercial break was your mental state, not just for when you get ill, which is a huge blow and you have to step up to the plate, so to speak. Your mental state plays a big role in your life in general, right?
Yeah, absolutely.
Yes. And I've seen people stuck, and it's unfortunate. I think that you don't need to be stuck. I think you need to move forward every single day, and you need to fight it. I had said to a friend, it's like, hunkering down, even though I was never in the service. I feel like I'm hunkering down.
Mm-hmm.
You're going into combat.
Well, you're fighting for your life.
You're fighting for your life, yes.
And your family and all that.
Yes,
Mm-hmm.
exactly.
Mm-hmm.
So, Dr. Kapoor, I know that in just the last week alone, and I know this seems to be an annual debate now, you can watch the news and read this or that. When should women get a mammogram? And wasn't there something just in the news in the last week or so about, changing the age?
There was. Again, you're right. It seems like an endless yearly battle that we go through. The American Cancer Society guidelines just came out again. And we said women should start annual mammograms at age 45 instead of age 40. And they should do those annually for about 10 years. And then after that, they can talk about it with their physicians and go biannual, meaning every 2 years, or they can still consider annual. And they also said they made this very complicated, unfortunately.
Yeah, no surprise.
They also said you can talk about and consider getting annual mammograms starting at age 40, which was the age that we had kind of all set in our heads and were comfortable with.
Absolutely.
They're so complicated, unfortunately. I do think that they were earnest in trying to help make sense of all the data and all the controversies. The big problem we see is when we do mammograms in young women, so women in their 30s and 40s, we have a hard time seeing anything because women's breast tissue is so dense. So mammogram is not so helpful.
Even though those stories exist.
Oh, definitely exist. What's more helpful in younger women will be breast ultrasound. So we have to kind of figure out the right balance of what to do. Certainly we see breast cancer in women in their 30s, but it's much more rare than finding it in 50s and 60s. Those guidelines are really tricky. And I think the point, at least from my perspective, is screening should be individualized. Each woman has their own risk, and a risk assessment should be performed, ideally with their physician, but to put that onus on primary care is almost unfair. We do risk assessment for every single one of our patients that we see.
Meaning like family history. Like do you have an aunt or a mother or a grandmother, or where is it in the family line?
That's an important aspect of it, family history, but also the woman's own history. Has she ever had a previous breast biopsy with abnormal cells? Did she have children? What age was she when she had children? What age was she when she went through menopause? All these things factor into risk.
And I think a lot of people don't realize that somehow, even though you have no control over those things, they do play a role. And why is it that they play a role in your risk factor?
Well, it's an important balance between how much hormonal exposure you've had. So if you have your first period when you're 12 versus
or 11
versus 15, you have 3 more years of hormonal exposure early on. If you have menopause very late in life, you have those extra years of hormonal exposure to your breast and cyclical changes that occur to your breast. If you get pregnant early, in your 20s, then you have a block of that exposure and that cyclical change to your breast tissue. And then if you nurse on top of that, you have even longer time where your breasts don't have that same hormonal exposure. So that's part of it. There's a lot more to it. There's a lot of genetic and environmental factors.
Yeah.
That's one piece of the puzzle as to why all of these things become a part of risk.
I can only imagine that, and again, if you don't want to share, we don't need to know a name, but is there any story that sticks out in your head that you've dealt with specifically, other than Mila, who is here with us, thank you again, that you think could be maybe educational or insightful for people who are listening, women, to hear that, well, this woman came to me and this was her scenario? Or
Well, I mean, I have that story every week, unfortunately.
Yeah.
I mean, it's not just any one, it's every week. So still, even with all the screening we have, every week at least, we see a woman who found her own breast cancer.
Just doing an annual, monthly.
Just by accidentally touching her breast.
Oh, accidentally.
Usually it's an accident.
Like oh, wow.
Usually I was putting some soap on, I slipped, and then what was that? Or I was doing an exercise routine and I noticed some soreness, and then I found this, and then actually, my sister was just diagnosed with breast cancer, so I went and checked my breast and I found this. So we have a lot of those stories, unfortunately. And the key I would tell people is to just get to know your breasts and feel comfortable with your own body. It's not just your breasts, it's your whole body. You have to kind of be in tune with who you are, what you normally should feel like, and then check in. Every month, ideally, check in again and
monthly.
See, is everything feeling the same and looking the same? And just to get a good sense of who you are, if anything's changed.
You can even hear stories about people who have pets. And their cat maybe climbed up on them and hit a spot.
I've heard that. It's true.
And then it's like, wow, what was that?
Absolutely.
You have heard that, yeah.
I have heard that. Actually, almost not so funny, but funny story, sort of. A woman's horse bit her in the breast.
What?
And because of that soreness, she came in and got some images, and we found a cancer.
Her horse was thinking, I'm going to help you here.
Maybe.
Let me identify something you need to look into. I mean, because isn't there this whole thing about they've trained some dogs to smell out cancer?
There's a lot of interesting ways of finding cancer.
Look at her. She's like, we're not going there. Wasn't the cover of the magazine something you wanted to talk about?
Oh, yeah. That some women might be asking. It's become a widespread and important piece of information. The cover of Time magazine just a few weeks ago showed a woman covering her breast, and the topic was, what if I do nothing about this breast cancer? So I'm happy that came out, because before we were talking about everyone removing both their breasts, even without cancer, and sometimes that's totally indicated, as in Angelina Jolie's case. But unfortunately, we do too much of that when it's not indicated. So fortunately,
out of fear.
Out of fear, exactly. Mila here was brave and said, I don't need to do that, and I know I have this history, but I've checked my genes, and I'm going to do what I need to do to get rid of this, but I'm not going to be overly radical. For some women, that's too much. For some women, that's the right approach, removing both your breasts. The article, though, was talking about, do we really overtreat some cancer? And we do, actually. Some breast cancer, and specifically stage 0, so not invasive cancer, but stage 0 pre-invasive cancer.
My girlfriend's mother had that. You don't hear about that a lot.
We're hearing
0.
about it more now, though.
Oh, are you?
Right, with extra screening, and that's one big controversy, we pick up extra cancer. And some of that cancer is going to be cancer that will maybe never cause a death of a woman. So the big deal is, how much are we being overly aggressive in treating it? And the idea of that article was not about just not treating it, but not doing everything we were doing before, like not doing surgery and radiation and hormone blockade, but actually just doing close observation and a blockade with a pill, with tamoxifen. So they're not doing nothing. They're actually doing something about it, but not as radical as before.
Wow. Anybody have any final thoughts as we kind of launch into our final minute here this morning? And thank you again for taking time to be here so early on a Sunday morning. We're good? I think we're good. Let's just give out the websites then. How about that? So, Monique, why don't you go ahead and give your website out again?
Our website for Integrated Cancer Institute is www.ici.care.
Okay, great. Thank you. And
for Breastlink, well, you can find me and others at Breastlink at www.breastlink.com. You can also find us on ici.care.
what if somebody listening this morning, Mila, would like to have you as a coach, a personal coach for their journey of going through breast cancer? How do they reach you? Or is that
contact Breastlink and contact Dr. Nimmi Kapoor, and their staff can route them to me.
I have her cell phone.
Perfect. You know how to reach her. Thank you again, Mila Ivanovich, who is the survivor and patient of Nimmi Kapoor, the doctor. And thank you to Monique Jenkins, the director there with ICI, and even Paul, who's been in the studio through all of this. Thank you. I'm Denise Westwood. This show is Spotlight on the Community here at 95.5 KLOS. We are the Rock of Southern California, and I'll be back at high noon today. See you then.